Mr. Abhijeet, can we go with the questions?
Yes, please.
Yeah, sure. So, can you tell us about your journey being a general practitioner into India to pursuing an MBA in Australia? What motivated this transition?
The first and foremost thing was the COVID.
Okay.
First and foremost thing was the COVID. I had been a frontline worker during my internships, and then more than 3 years I had been working with the Delhi government in the Department of Cardiology. But overall, it was altogether the COVID works. So, but within that system, when I was working in the hospital, it was like I couldn't make the change from inside. I had to follow the orders, and there was a lot. I was in the system, and to be honest, the news was not covering all of it. So we had to face real difficulties during the COVID pandemic. And my sister is also an MBA in hospital administration, and she has been an inspiration for me to do an MBA.
Mm-hmm.
So she is in the consulting side for 6 years now. So I'm just trying to follow her footsteps to be into the consulting side and work with the WHO, United Nations, and serve the community on a larger level, so that I could at least try to make some change, which I didn't have the opportunity to from within the system. So this is what I'm trying to achieve. So that's why I opted for an MBA here in Australia, to have some hands-on experience and be in the policymakers, be with the policymakers later on in my life. So that's the whole point of leaving everything and transitioning from being a doctor to a consultant.
Right. That's really great. Being a doctor, you cannot have all the you can't take authorities, right? But
Yes.
being into MBA, you can have the authorities to change something, because
Yes.
that will be a constant field there. You can't
Yes.
go beyond the patients.
Yes, well, exactly.
Yeah, got you. So how has your medical background influenced your approach to studying business and management at, say, Swinburne University of Technology?
Yeah, that's Swinburne University. So the first semester, I'll be in my third semester next week.
Okay.
The first semester was actually really difficult for me, because all the presentations, the public speaking, you have to be something which I didn't do, and there was the finance and accounting things.
Completely from medical background to coming to this
Yes.
management means totally different field, right?
Yes, it was a very difficult phase for me last year, but it's becoming step by step, day by day. I'm learning, and I'm not stepping back. And I'm proud to say, I have been receiving distinctions at Swinburne
Great.
University, and now I am in the top 15% of the university. So I'm doing my best, and I am actually loving it. What I'm doing right now, I'm just loving it, and every day I am thankful that I feel like I'm on the right track.
Right.
So, and when I was doing this, my parents, my friends, my family, all of were against doing this, because what are you doing? They were all like, what are you doing? You don't want to do that, and just at least be in the medical field, because I have spent 9 years in the medical field, and leaving everything altogether was a difficult phase. Yes.
So, could you share your experience working as a junior resident doctor, medical and research? What were some of the key challenges and learning experience?
The key challenges was the lack of infrastructure within the hospitals. It was a government facility, and they were there were a lot of hurdles, because I was at an entry-level resident doctor. I have to follow the orders. I was working in the ICU, and sometimes I was working in the emergency. And overall, there were only 6 emergency beds for the department in the Department of Cardiology, and we have been facing a lot of patients incoming, and because of the infrastructure, because there were only 6 beds, and there were at least 18 new MI patients. It was specifically a cardiology and neurology emergency, and 6 beds for the cardiology and 6 beds for the neurology. So overall it was a very difficult phase because we have to figure out to whom we want to give this bed to, who is more sick. So that was one thing, we had to take hard decisions on the spot. This was really hard to decide if he or she is the one we want to treat, or we have to refer someone. And the cath lab over there was working 24 hours in the stunts and the bypass surgeries. So the patient flow, the OPD were actually really hard. So we had to work, sometimes we had to work 24 hours straight.
So next, like, how did your role as an intern at Narayan Medical College and Hospital shape your initial medical career?
That was actually part of my undergraduation. The internship is a part of my undergraduation. We have to follow the 1 year internship in order to get their degree. So the internship at that time, it was my medical school at that time. I didn't have the goal of doing an MBA. I was just preparing for the PG examination, and I wanted to be a good doctor. And that's what I wanted to be at that time. And overall, within the next 2 years, it was in the middle of my internship that the first lockdown came, and we were working as a COVID worker. The whole internship, they were, so the thing in internship is, not usually you have 2 months posting in the medicine, 2 months posting in the surgery, 2 months in the gynecology, 2 months in the pediatrics, and this is how the 12-month structure of the internship in India is. But the whole year, when the 2 months for medicine, we were working in COVID. 2 months for gynecology, we were working as a COVID worker. 2 months of the surgery, we were working as a COVID worker. So the whole of my internship I was a COVID frontline worker.
Fantastic.
So, yes.
Really great. So what was like working on 110 group of an associate in management consulting? Can you describe a project you worked on that you found particularly rewarding?
This was one thing when we were analyzing the strategy for the next year, when the ESG&I was launched in March, and I was working with 110 to make this launch of ESG&I successful. So I was the one, and I even consulted my sister for this because they want me to help in the strategy, and she was like, "How can you help them?" So this was one thing, a learning and rewarding experience for me to help the founder, and I got a really good appreciation for my work over there. So, and this was the first time I was working in the corporate world. I'm still learning how does the corporate culture work. So I had been in a hospital setup all my life, and this was the first experience for me to be in the corporate setup, and I love the experience, and I want to be in the corporate and help the people.
Right. Your future aspirations. So how do you plan to merge your medical expertise with your newfound business acumen in the future?
The first and foremost goal for my career would be to work with WHO, World Health Organization, and United Nations, and travel the world and serve the community, maybe in Africa, some of the other countries that really needs people like me who have the experience in the medical field and the consulting. Because according to my research, there are not many doctors with an MBA, and I really look forward to it. So I don't know if I'm gonna be successful, but I'm trying my best to achieve that goal.
Sure, definitely you'll be more successful. As if now you're seeing your joy, or you're like working on your heart. What your heart is saying, you're going through that, right?
Yes.
Maybe you'll be definitely successful one day. We'll see you on WHO. Right, sure. So, what are your career aspirations once you complete your MBA, and there are any specific areas within healthcare management that you are particularly passionate about?
In the healthcare management, I would again say the social impact and sustainability. And I have a mentor from my last semester who has been a director in the KPMG, KPMG Netherlands. And so he has retired. He has voluntarily retired from that position to be an academic, and to teach the students. So by the age of maybe 45 to 48, I want to get a PhD and teach another students like me who want to make the change. So that's what I want to do.
Wow, superb. You want to get a great impact on them also. So how do you envision the role of technology, especially AI, in transforming healthcare management in the coming years?
It will be actually a big thing in the healthcare, because we already have the stethoscope, the monitors, the everything else, the home monitoring systems. Everything is based on AI, and just AI. The computers would notify the doctors and the nurses. So AI is going to make a lot of changes, but in the end, it's the value of relationships and people. You can't really replace the doctors and the nurses, and you can't really replace the human touch in the care. So AI won't be able to replace that, but the technology is definitely going to help the healthcare workers in the long run.
So that's the end of the questions. Lastly, I would like to ask you, how do you see potential collaboration opportunities with our organization, ESTAH Society, as the We Heal the Earth framework?
This is the most difficult question for me right now, because I am currently in the entry-level jobs, I would say. I don't have that kind of experience, but I would love to explore the collaboration. I'm going to be really honest here, because I have never been a mentor except for my juniors in the medical college. So I have been a mentor for the my juniors, but in order to achieve this, I really look forward to in the collaboration. And one thing is we share the same goal to serve the community.
Yes, exactly.
We share the same goal to serve the community, and anything if I can do to achieve that, I would be more than happy to do this. So and the other thing I wanted to share, my father is an MSc in agriculture soil.
Oh, great.
So this is something I could really relate, because he was a CEO for a veterinary organization when he retired, and other than previously he was the national sales manager for Sarabhai Veterinary.
Okay, great.
So this is something that the soils, the farmers, the techniques, the techniques this society has been helping farmers with. So I could totally relate, because I have been seeing my father all my life too.
Yes, since your childhood, I guess. Yeah. Thank you so much. It's really wonderful having you. It's a great journey. So we wish you all the best to you.
Thank you so much. Thank you so much.
Thank you so much. Have a great day. Bye.
Thank you.